Hello, my name is Jones Muna. Today, we look at levels of consciousness in nursing care. 1. Definitions. A. Consciousness is a state of wakefulness in which an individual is aware of oneself and the surrounding. B. Unconsciousness is the opposite of consciousness. It is defined as a physiological state where the patient is unaware of oneself and of the surrounding. 2. Levels of consciousness that a patient may exhibit include a deteriorating level of wakefulness. I. Conscious. In this level the patient or client is fully aware of oneself and of the surrounding. He or she is said to be fully wakeful, normal, alert, attentive and is oriented to self and the surrounding. I. Confused. In this level, the patient is said to be in an impaired or slowed thinking or said to be disoriented. E. Delirious. At this stage the patient is restless, disoriented and there is clear deficit in attention and possible incidence of hallucinations and delusions. If. Somnolent. This stage is marked by excessive drowsiness and little response to stimuli. V. Obtunded. This level involves the patient having decreased alertness, slowed motor response and there is sleepiness. Vi. Stuporous. Conscious but the patient is in a sleep-like state associated with little or no activity. The only responsiveness is in reaction to pain. Vi. Comatose. This is the final negative stage in the altered level of consciousness. The patient does not respond to stimuli, cannot be aroused, has no gag reflex and the pupil does not respond to light. 3. The levels of consciousness in a patient can be assessed by using simple but key components of the patient's neurological function such as verbal or motor response to voice or pain. This enables for the estimation of level of wakefulness and awareness at a particular time. The most commonly used tool is Glasgow Coma Scale, GCS. This scale attributes a number or category to the level of consciousness, as shown below. 4. How to nurse an unconscious patient. The unconscious patient has total self-care deficit and wholly depends on the nurse, relatives and other health care providers for their sustainability of life. As a nurse, the care ranges from providing for the basic life-sustaining activities to prevention of complications arising from the unconscious state. Apart from the routine care, as a nurse we have to emphasize on the apt criteria of care: airway, breathing, circulation. As nurses we should do the following in order of priority during the care of the unconscious patient. Maintaining a safe environment. This is necessary so as to prevent death resulting from mishandling of patient or unsafe environments such as bad air, temperature and falling. We also have to maximize infection prevention measures to prevent cross-infection. Raise the rails of the bed or put on floor bed for restless patient to avoid injury from falling of bed. Assisting respiratory function. As a nurse, we put the patient in lateral or recovery position with head turned on sides. This promotes drainage of secretions from mouth and nose and prevents tongue from falling back. The neck is bent back and jaw pulled forward. We would also suck if there is any oropharyngeal secretions and ensure the airway is patent and patient is breathing effectively. If necessary we can insert artificial airway to prevent tongue from falling back. The patient can also be artificial ventilation if he or she stops breathing due to something that is treatable such as snakebite, poisoning by drugs, etc. Promoting cardiovascular function. As a nurse, we will ensure there is good circulation by initially and continuously checking the patient's vital signs, blood pressure, pulse, temperature, as oftenly as required. Any abnormality to be treated such as low blood pressure by giving the prescribed intravenous fluids, subnormal temperatures by providing a warm environment. We would also raise foot end of the bed to promote blood circulation to vital organs when necessary. We would also do 2-hourly turning of the patient and pressure area care to prevent formation of pressure sores. Maintenance of patient body hygiene. Patient's hygiene plays an important role in their recovery. We would give the patient daily bed baths, hair care, nail care as necessary, daily mouth care. This promotes comfort and prevents bad odor from patient's body. We would also change patient's linen whenever visibly dirty or have been overused. We would also do catheter care if patient has indwelling urethral catheter to prevent urinary infection. Observations. Observation is a very important task to carry out as a nurse. In the unconscious patient, we would observe the vital signs to determine if patient is improving or not. Also observing the urine for volume, odor, content to see if any sign of other disease or infection and assess renal function. We would observe if patient opens bowels. We would also observe pressure areas for any redness or sores to detect any risk of development of pressure sores. We would also observe the patient's level of consciousness to determine if improving or not by using the Glasgow Coma Scale. The frequency of the observations will depend on the prevailing patient's status. They may be done hourly, 4-hourly, 6-hourly, 12-hourly, daily or as necessitated by the condition. Drug therapy. As nurses, we would give the prescribed drugs at the right time, in right amount, through right route. The patient may be on drug therapy for infection or metabolic condition, such as insulin for diabetes mellitus, or on pain-relieving medication. We would ensure patient misses no dose to promote recovery and comfort. Maintaining patient nutrition and hydration. An unconscious patient will not be able to take foods or fluids orally. Therefore, it is our role as nurses to ensure nutritional needs of our patient are met. The patient is on liquid diet usually given by nasogastric tube or an intravenous fluid therapy. We ensure that the patient is given the right prescribed diet in the right quantities at the right time and through the right route. We would also maintain a strict input and output chart by observing the quantity given and the excreta as stool and urine. The fluid or liquid diet is necessary to be given entirely to promote gastrointestinal function as well as urogenital function. Prevention of disabilities. The unconscious patient does not make use of most skeletal muscles and joints and are therefore at risk of becoming wasted, rigid or stiff. As nurses, we would do passive exercises of muscles and joints to prevent these permanent disabilities. Exercises also promote blood circulation and nerve function, thereby promoting recovery. Maintaining privacy and patient dignity. As nurses, we would promote this by screening the bed whenever doing procedures which compromise privacy and dignity, such as bed bathing, tube feeding, catheter care, etc. We would only expose the body part that is being worked on. Exposing the patient unnecessary is embarrassing and disgracing, especially to other patients and patient relatives. Psychological care. This is quite difficult but very vital to an unconscious patient. The task is challenging to the nurse because the patient is not responsive. However, we would talk to the patient as we carry out daily nursing care procedures on this patient. The sense of hearing is final to go, so the patient may hear but unable to respond. This comforts them and is therefore very necessary that we speak to them in a soft and caring attitude. We can also involve patient relatives in the care, such as in carrying out simple procedures such as combing hair, cutting long nails, applying body lotion. Touching the patient comforts both the patient and relatives. We would also communicate to the patient and relatives about anything necessary patterning patient's condition and healthcare plan. Remember to subscribe to my channel. From me, I'm saying, thanks for listening and keep studying.